Okay, this video is going to cover the skin, hair, and nails checkoff. The process will be you come in, introduce yourself to the patient, wash your hands, and then you're going to elicit a history from the patient as we have discussed in the lecture. Once you're done with that aspect of it, you're going to move on to your checkoff. Now, in regards to inspection and palpation of the skin, hair, and nails, you'll move from head to toe as you do the examination. And with the skin, you're going to be articulating that you're looking at the color, the symmetry, texture, hydration status and turgor, and general hygiene of the patient. You're going to look for lesions, and any lesions that you see, you're going to describe them. And their distribution, okay? Are they localized or are they diffuse? Basically the color, the best description you can give, you want to document that. Is it a primary lesion or a secondary lesion? Is it a vascular lesion in that nature, or any other type of lesions? You're going to describe those. So we're going to start out, and then with the hair, again, you're looking at the color, the symmetry, distribution. Is that normal? Again, hygienic care. And the same thing with the nails. When we get to those, we'll talk about the firmness, the texture, adherence to the nail bed, length, general hygiene from that standpoint. So starting up here, we're going to look at the scalp for any infestations. Hair distribution is normal. We move around, basically we'll see both sides here, looking behind the ears and the neck, posterior aspect. And then anteriorly, we're looking at the face, the symmetrical appearance. There's no lesions, normal color. And then we move down to the shoulders, upper extremities here, checking the axillary area for hair distribution to see that that's symmetric here and here. And then the anterior chest area, we're going to actually feel these areas for any warmth, tenderness, anything of that nature. Okay, and then we'll look at the nail bed on the upper extremities. Again, looking at capillary refill. There's no defects or abnormalities that we're looking at. Adherence to the nail bed is good. Then we're going to measure nail base angle, so I'm going to have you do that. And we're looking right here between the fingers to see if there's a gap there. If he has clubbing, then that nail base is going to come apart there. And you can do that with the rest of your fingers. Kind of run through that. Good. Okay, very good. So that's nail base angle. Then we're going to move to the anterior portion of the legs and look at the hair distribution, skin, again, feeling both of those. And I'm going to move right down to the lower leg. Hair distribution is symmetric between the two. We're going to look at the nail beds on the toes, no fungal infections. Looking at the bottom of the feet as well. Same thing over here. Just checking those nails. They look normal, good hygienic care. And then no lesions on the soles of the feet. Okay, now we're going to have him stand up and face the wall over there. And we're going to look posteriorly at his back area. He would be in a gown normally. You would have total skin exposure here, looking at the gluteal region. And again, down the posterior aspect of the legs, looking again for all the same things: color, symmetry, texture, any lesions of that nature. Okay, have a seat back up on here. And so next is the lymphatic system portion of the checkoff. We're going to again inspect and palpate the lymphatic system. The things that you're going to be looking at and documenting are size, consistency, pain, location, character of them, whether they're smooth, nodular, regular feeling, the symmetry between sides, mobility, temperature of them, feeling if there's any pulsatile nature, you know that that's not a lymph node because they usually do not pulse, so you think more of a vascular element if it's pulsatile, and then vascularity and degree of redness if there's any lymphangitis going with it. So we're going to be looking at the visible nodes that are palpable for any edema or erythema, red streaking, or anything like that. And so the lymph nodes of the head and neck, we're going to start with the occipital region. So I'm feeling right behind him here. And I'm feeling for any lymph nodes back there. And then the post-auricular pre-auricular, parotid area, retropharyngeal, submandibular, submental, and then the anterior cervical, posterior cervical, and that's that sternocleidomastoid muscle we talked about. So I'm feeling that posterior triangle back here. Okay, and then we're moving down the neck and just kind of roll your shoulders forward a little bit. And then we're going to feel the supraclavicular nodes here. Okay, relax. And then infraclavicular. And then we're going to move to the axillary region. I'm going to be checking I'm going to take his arm here and pull it away a little bit. We're going to feel the subclavian, which are here behind the pectoralis muscle, the central axillary, feeling up here again with the pads of my fingers, and then the subscapular, posterior, and then the brachial, okay, and then mammary, and again on the female we'll do the mammary exam when we do the female breast exam, but you're going to feel up in this area as well here. And then I'm going to come down and I'm going to keep his arm flexed, and I'm going to feel the epitrochlear nodes in here. And we're going to do this on both sides. Okay, and you should not palpate them under normal circumstances. And remember that we're feeling for the size of them. Anything over 1 centimeter is a little bit worrisome. So next we're going to have you lay back, pull this out. We're going to palpate the inguinal nodes, which are basically right along here into the medial thigh area. We're going to check on both sides there. And then the popliteal area, we'll have them flex up just a little bit here like that, and I'm going to feel right under that popliteal area for any swollen lymph nodes back there. Again, we would do this on both sides. And then additionally, I'm going to look at the lower extremity for any edema or lymphangitis, and look again for symmetry there to see if there's any swelling in either of the lower extremities. And if they do, I would see if they are using any sequential compression devices or compression hoses to treat that. And that is basically the exam for the lymphatics as well.